Hello, everyone. Thank you for joining us. Happy Monday and good afternoon. Um, you know, if you remember back into that terrible winter storm that we had in February, a person reached out to me named Judith Oppenheim, saying that she'd been working with the COVID tracking project and for Texas, and she wanted to show me some of her data. And fortunately, I had enough power, and so did Dr. Oppenheim, that we were able to go over some of the material she's collected. And I think it's going to be fascinating. Let me just give you a bit of an introduction to what we're going to talk about today. So the COVID Tracking Project is a volunteer organization. It launched from the Atlantic magazine on March 7 and collected in March 7, 2020, and it collected and published data on the COVID-19 outbreak in the United States. And the website was an essential source of data on testing, hospitalizations, deaths, for media reporters, public health experts, general public. If you remember the weekly updates I was doing with Houston Matters, I relied very much on the data from that project. Now, the Texas expert for that project is Judith Oppenheim. Dr. Oppenheim is a process development chemical engineer who earned bachelor degrees of science in chemical engineering and math sciences from Rice University in 1978, and a PhD she earned in chemical engineering from the University of Houston in 1983. Throughout her career, Dr. Oppenheim has conducted computational analysis of process data, which is how she's able to come up with such marvelous information about COVID. And she's contributed to 13 patents in the areas of gas purification, nitrous oxide abatement, and gasification. So we're going to have a bit of a discussion with Dr. Oppenheim, although mostly I'm going to hand things over to her. We are going to have a Q&A box open, and you should feel free to enter questions in there. We're going to save the last 20 minutes of our time for questions and answers, so just enter those in and we will get to those questions. So before we get started formally with the slides, Dr. Oppenheim, how about you tell us just sort of a little bit about how you became involved with the COVID tracking project?
Well, I was early in the pandemic. I was putting my data together, and I had a lot of questions about the metrics that the Texas DSHS was posting. I did literature searches. I joined the Houston coronavirus Facebook site, and I entered into discussions with other people who were in the area. And in the course of my literature work, I found the COVID Tracking Project site, and they were looking for volunteers. I just put my name in, and the following day they called me.
Well, that's wonderful. Well, I know you presented some new slides to show us. So why don't you take a minute and go ahead and get up the shared slides, and feel free to start whenever you're ready.
So what I'd like to cover in today's talk is the lessons learned from working with the COVID Tracking Project community, and some future plans where I'm going to go with this from today. When I first started working with the group, I saw that they looked at the 50 states and also some territories like Virgin Islands and Puerto Rico and Guam. And I felt, because of Texas's large size, that maybe Texas was worth having more than one entry in their database. The idea was that it's over 800 miles east to west and north to south, and that's large enough to put countries like France, like the UK, like Germany, like Italy, that the United States was being compared against. And here we had a state that was really of the right magnitude and population of these European countries that were much further along in their experience with the pandemic. But more importantly, the distances and the geographic context for the state made it a source of variation. A lot of your West Texas and Rio Grande Valley communities were pretty far from the labs where their COVID tests were analyzed. And so this created a delay, and that was something that was different about the cities. And in order to take that into account, it would be better to have the state divided that way. Also, the effect of climate, we know this is important. And what happens along the Gulf Coast, where you have more of a tropical climate, is much different than in the Panhandle or the West Texas desert. So I was not successful in having this special accommodation for Texas. And the other extreme was to look at all 254 Texas counties. And this just was a lot of unnecessary work, because you, especially in different parts of the state, people, for example, in the Houston metro area, you're interacting with people that live out in Katy and Galveston. Everybody is mobile, and really these metro areas mix it up with people from all over the world. And this is a factor in North Texas, where you're centered on Dallas and Fort Worth. Austin and San Antonio go hand in hand for Central Texas. And then I put the whole Gulf Coast, along with some of the other counties around Harris, to all be represented by the Gulf Coast numbers. And then the border results will go all the way from El Paso to Brownsville. Now, I feel like this is a compromise, but other approaches could have made use of the trauma service areas, where there are 22, or the Texas public regions, where there are 10. But keep in mind, and I tell this to people all the time, no other state has 254 counties. That amount of data bureaucracy, where every single county is working on managing numbers in its territory, within its boundaries, is, in my mind, an obstacle to people understanding and beginning to appreciate the numbers that they're looking at. And if they only had 5 to 20 numbers to keep track of, I think it would sink in and have a better context and appreciation for the state of the pandemic in their part of the state. So on your screen, I have 2 different graphics the top graphic is a COVID data tracker where every state is represented by a bubble. And the part of the country that the bubble is in is either blue for Midwest, yellow, green, and rust for the South. And Texas is classified as a southern state. And what's really interesting about this recent plot, it's dated April 9th, is that Texas is like the center, it's at the origin. And what it means is that it is at 100 million hospitalized per million population, 100 per million. And the August number for Texas is very close to the average, which is 98. I have a table to the right which shows that even though as a state we are close to that average, calculated it's more like 94, you can see that the range 61, 137, the median at 76, there's quite a range to consider when you look at just one number. And it would be interesting to know whether other states had this kind of range or not. Now, the statewide number is 465.7, whereas if you looked at on a region basis, you have Central Texas at 516 total hospitalizations, the Gulf Coast 1224, North Texas 676, the border 353, and the Panhandle 91. Statewide, the number is 2860. So you can see that it makes a lot of difference whether we're talking about an overall number or else on a per million population. And not all of these numbers are the same. And if you lived in one part of the state, or if you were going to travel, you would want to know how different that other part of the state is compared to where you were. Another advantage in looking at the breakdown by region is to also look at how this a time series of that breakdown, how it develops. And what we can see that the peaks associated with the recent surge varied depending on where you were. It looked like that it was traveling from northwest to southeast and then back, reaching down into the Rio Grande Valley last. And that's of interest because when you look at the statewide data, you have peaks when you look at the cases that seem to break out around the weeks where this data is taken from, the case data. And those weeks, unless you had this breakdown, you wouldn't really know what was causing them.
So Judith, I mean,
Yes.
If you could go back to that slide, it's quite fascinating because it looks as though right after the holidays, the orange line number 3, which is, includes Dallas-Fort Worth, was much worse than the blue line, which is the Gulf Coast. But it looks, and so it's almost that that although they reverse themselves, and now Dallas is doing much better, and the Gulf Coast is the worst of the various different areas. It's almost as if the more cases you had before, you built up some immunity, and then you managed to do better later on.
I do not know exactly what happened. What you're pointing out is what happened, and it seemed like the two areas switched places right after the Texas freeze and power outage. Everything I'm reading is that the Gulf Coast was hit much harder than the Dallas-Fort Worth area. And that, we're also hearing about some of the more unfortunate cases from that period. They're in the ICU right now, and they're really, really struggling. And if Dallas had fewer of those kinds of patients, then they would have cleared the system, and that is where we are.
Yeah. I mean, it's very nice that you've added the freeze time in there, and I think some people were concerned when the George R. Convention Center was open and things like that there would be an uptake in cases, and certainly there were plenty of people who were sheltering with family. But one doesn't notice a change in the slopes of the lines for either Dallas or the Gulf Coast. So it's, but that's quite interesting.
Yeah, I was looking for discontinuities. I was looking for I was looking for those effects, and they never showed up. One thing that did become apparent is that there was a step change in the cases before and after the week of February the 14th. I believe that the cases took a drop, and then the numbers the following week were, maybe a little bit larger. I also believe that there was a switch from PCR tests to people doing more of your over-the-counter quick answer tests, and those don't get recorded on my plots because they are probables, and my plots for cases are only showing confirmed cases. And that's why I plot the hospitalizations, because a 7-day average of hospitalizations is what, it doesn't, it's not as early as case data in terms of where the pandemic is, but it does give you a feel for, and the hospitalization data is we have reporting rules, and the throughout the state we get a good coverage and a good track record for those results.
Thank you.
I'm going to look at my breakdown of the individual parts of the state. And we're going to talk about the Dallas versus Houston area in the top graph. And we talked a little bit about how right after the winter holidays, Dallas-Fort Worth was higher than Houston. And then after the freeze, they switched. The data looks like the orange, which is Dallas Fort Worth, is reaching a plateau, whereas and leveling out. We don't know if it's going to turn back up again. It's just too early to tell. But the slope does look like it's changing, whereas the Harris County and has a negative slope, and it looks like it's had that constant slope for several weeks now. For central Texas, I'm looking at Bexar County, which has San Antonio, and Travis County, which is where Austin is. And those two parts of central Texas are coming together. And it looks like that some slope or some change in slope is happening with respect to the Bexar County. And then what's most interesting is the border region. Let's go back and see what the border region looks like. And it has two lobes to it, 1 and 5. And if I were to do this redrawing of the map again, I would break the border into two pieces, because actually, if you're going to look at climate as one of those factors or criteria that should be constant within a region, the lower part of the Rio Grande, where the Rio Grande Valley is different than the other end of the state where El Paso is. And so this shows up as two lobes on the time series data for the border. And I proved that to myself by plotting the county data for, and I included an intermediate result, which is the orange, Laredo, and then El Paso, which had the big peak early on, and then the Rio Grande Valley much later. And so together, you can see how they add up to that lobed profile. The calendar on the right is where I have different events that I always keep in mind when I look at the data. And we started giving vaccinations towards the end of December, and we reached 1 million vaccination doses between the middle of December and the middle of January. And we were well into vaccination when the freeze and power outage happened. And so this may be one reason why we didn't see more an effect of people congregating in your shelters. FEMA opened their mega hubs in your larger cities towards the end of February. And as you know, the mask mandate ended about a month ago. And the next date that I am looking at to see if there's any effect is the Rangers Stadium, which is filled to capacity a few days ago. And we're going to compare that against the Astros and maybe have a little competition. One was filled to capacity, and then the other, the Astros at 50%.
You know, it's also interesting, Judith, when you look at these slides, that El Paso was the only area that had a decrease in cases over the winter holidays, which I guess is a signal of just how bad it was there before.
Well, if you remember, there was a lot of legal back and forth between our state attorney general and Judge Samaniego. He wanted to have more authority to shut down businesses, to enforce local, more strict, um, um, penalties, and the governor's office was refusing to work with him on that. But finally, there were the compromise that they went along with is to have a they did have a compromise, and the El Paso public was going along with it for the most part, and it shows up in the data. And the same approach is happening once the mask mandate was canceled. Both El Paso and Austin decided to keep their own local mandate, and they were challenged, but neither challenge has gone to court.
Mm-hmm.
So now I want to end with talking about variance, vaccinations, and visualization. This comes from the CDC, and no, not the CDC, the Texas Health and Human Services. And you can also find similar plots on the CDC website. But I wanted to go through a few reactions, a few observations when I pull up this site. First, there's a lot of text, which you, especially if you were looking at on a phone, you would really need to zoom in on if you wanted to read and understand the details behind what you were looking at. And what is bolded and the numbers that are given prominence are very large cumulative numbers that represent data that's been taken over a long period of time, even though a picture like this is kind of a snapshot. And talking about a snapshot, where is the date? If somebody puts this snapshot in their social media and broadcasts it, and you don't see it for maybe 2 or 3 weeks, how are you going to know whether it's current or not? And there's an updated message, which is in very small print. And it's so small that when I did my screenshot to insert in my presentation, I even accidentally cropped it. So it's not here. But these large numbers, people cannot grasp or keep them in their brain for long periods of time. And instead, what I would recommend is to do this on a percent basis. And the attempt in the color coding is to provide that information on a countywide basis. And it's good that all your plotting choices are on a percent of population, because whenever you do a map like this, if it's absolute numbers, they are going to give preference to the rural areas, because the rural less highly populated areas of the state take up more area, okay, take up more space on the screen, they are going to seem more important, even though most of your people live in the cities and those have a higher population density. So whenever you're doing a map like this, it should always be on a per population or on a percent population basis, so that you can compare one county versus another, which is what this graphic is designed to do.
And that's a really good point. I mean, there's many people, not everybody. I mean, they know that the population of Texas is 31 million, and that is not even listed to the right. So it's very hard to sort of judge what does 12.7 million doses administered mean. And then it also doesn't, it's sort of then when I don't know what the number of off the top of my head, what the number of Texans 16 and older is, and that's a smaller number. So
it's 22.3 million, and that number is very important in order to get from these numbers on the right to the colors on the map. And it would be nice if you had first only 3 digits of significance, and 2, to have those percents so that, or the ability to make a ballpark calculations so that you could prove to yourself that you understood where these numbers were coming from.
Mm-hmm. Thank you.
So that question and the discussion flows naturally into this table. And it is a very busy table. It has all the different regions. And what I do is I add up the regions and get the statewide number. You should be able to reproduce the numbers in the table, or else I've made a mistake. I show the number of completely vaccinated people on April the 3rd versus April the 10th. So this is a 1-week increment. And then I have the total people that in each one of these areas that we would be shooting for. And then the weekly increment. And so this is a natural flow of a simple calculation. And that's the only time I would include all the numbers, all the digits. It's a simple calculation. It has information that would be useful and repeated from 1 week to the next. So it's kind of leaving footprints in my writing, in my record keeping, so that one can follow the data. And then when things begin to change, we have that bridge of when it happened, and if we need to, we can drill down further. The most important takeaway is the percent, the number that we had completely vaccinated on April the 3rd. And you can see that the number varied from 20 to 28.5, with the overall state number being 22.3%. And then you can look at the increment for the week, and the part of the state that had the largest increment is the border, 3.8. They were able to get a 3.8% increase, so that their total on April the 10th is 32.3%. So they were able to exceed the 30% milestone, and us in the Gulf Coast are at 25.6%, which is pretty much the average of the state. Now, this is of concern to me because we have 560 cases where different variants have been measured. And this is more than half of those for the state that, if most of the variants are showing up along the Gulf Coast, we need to get our vaccination numbers as high as we can, as early as we can, because those variants are going to go after those that are more vulnerable. And those who are more vulnerable are those who are not vaccinated. And what they've shown in Michigan is that your 18 to 49 and primarily your 20 to 29 age demographic is where the numbers are taking off and carrying the state into a surge that's higher than it's seen to this point. And they had their peak back in December. And if you lined up their peak with when Texas peaked in January the 10th, you can see that they are taking off. And we are in a mode where we have a lot more people in that younger age bracket vaccinated than they do. And it's getting behind in this part of the demographic that is going to any part of the state that has a problem getting that demographic vaccinated is going to have trouble keeping the numbers down. And this is what Michigan is struggling with right now. Oh, so where am I going to go? And because vaccination rates are key to the next 6 weeks, and because the Gulf Coast is, I would say, we're not the highest in the state, and we need to be, because this is where the variance ground zero in Texas is. It's getting out the vaccine, just like getting out the vote. And that is where I'm going to be putting my volunteer time. You know, we've kind of reached an end of the road with a lot of these paper studies. You know, collecting the data is so much better than it was at the beginning of the pandemic. There are all manner of good dashboards. You can have a good conversation with people in the press, with people in academia. I am confident that you know, the data, it won't take more than a day, if any questions come up, to figure out exactly what we're looking at. What requires more time is to reach out to underserved communities, to get people on the schedule, on their calendars, and to get them to their appointments, and to make sure that we have the supply of vaccines where the people who are you know, needing them and haven't been able to find a source to this point. We've been in the vaccine rollout since the holidays, and that's putting us 3 months into this. And we need to make the next 4 weeks. We need to get past 50%, 60%, 70%. So the herd immunity characteristics really begin to become apparent. We're so far away from herd immunity that nothing, that we're so far away that we need to do everything we can to make sure that we have appointments set up so that we can actually get there while the supply is plentiful, and we need to minimize the wasted vaccines. So thank you very much for giving me a forum of going over what I had and worked with over the last few months. It was great having exposure to people from other parts of the country and using Texas data to benchmark against other parts of the country that were either earlier in the pandemic, or if there was some aspect of their experience that we weren't going to see until much later on. It gave me something to charge my frame of reference with. And, and it's testing that hypothesis. Testing that understanding is how you learn when this is outside of your training. And I feel like I did learn a lot. And, now I'd be happy to answer questions and get comments from some of you who may have been closer to some of this data or have questions in the way I presented it.
Well, thank you very much, Judith. I've got a whole slew of questions, but I will defer to other people asking questions. If you're not familiar, what you do is take your mouse and you can hover over the bottom of your screen and a Q&A box will pop up and you can type your question in there. So we've got a question from John Finger. Rather than average hospitalizations per week for a region, shouldn't we look at hospitalizations per 100,000 in the population? Otherwise, how can we compare different regions with different levels of population? Thanks.
You're exactly right. And what I did is I looked at both, and probably for this audience, I could have done all on a per population basis. I did teach, and my colleagues at COVID Tracking Project know about the different parts of Texas now, and they understand that the Panhandle has a much smaller population than along the Gulf Coast. And they know that Houston, Harris County is the largest county, not only in Texas, but also in the country. And the Texas Medical Center is, a huge hospital complex. So it puts all our data in context. And I think working first when you're in that learning mode with absolute numbers, and then once you get the scale in your data bank, and you're familiar with which area is larger and has more an effect on the statewide numbers, then that is the stage at which you put it on a per population basis. But you're exactly right. If I were to go back and maybe do a publish version of this presentation, I would do 2 sets of plots and have one set all on a per population basis and another set on absolute numbers. Now, early on, when I was posting to Facebook, I did the panhandle on a per population basis to show that its numbers were way out of line, that they were on with numbers that were certain counties like Potter, like Amarillo, those numbers were being inflated by the meatpacking industry and then others in the panhandle, your private prisons. And it's those two, the workplace, where you have people working in close contact, and you have the congregate living situations such as prisons and your nursing homes that were putting the panhandle at a disadvantage. But people from that part of the state were very resistant to the message I was trying to get across to them. And in their opinion, they didn't really see or know people who were sick. And having the numbers scaled in that way, it was a calculation that they weren't sure they could trust because, I'm not an expert, and the numbers were different than what they were seeing in other places that the numbers were being reported. So I've gone from one extreme to the other in terms of how I presented. And thanks for asking the question.
Thank you. So, you had alluded to this before, that there is this concern about people sort of taking rapid tests, and you're not seeing that in your data. And we are seeing dropping cases both in North Texas and in the Gulf Coast now. Have you been looking at the relationship between number of new cases and hospitalizations to see if hospitalizations perhaps aren't declining as fast as one would think, given the number of cases declining?
Let me pull up the graph. So we wanted to, this is the hospitalization numbers. And it's on, you can see all the different parts of the state. And the hospitalization numbers are plateauing along the Gulf Coast, such that we're almost stuck in the phase 3 where we were last summer before the mask mandate went back into effect, or went into effect, and the restrictions on restaurants and bars were rolled back. So the Gulf Coast is having very slow decreases, whereas the North Texas numbers were able to go all the way back further to this time of year before the summer surge. And they are similar to the panhandle in being able to get to those low values. Now, the question is wanting to look at the hospitalization numbers and cases at the same time?
Well, just saying that, the cases are showing a very rosy picture, and but we may not see the same thing in terms of hospitalizations.
Yeah, this is hospitalization data. And let me.
I mean, they still are going down, which is, good.
Yes, and I can pull up the individual regions, but this is what we have for the state. And the cases are just holding like around 20,000 per week.
Mhm.
And that is goes along with the total hospitalization, which is around 3,000 per week.
Mhm.
On a weekly basis, or
Right.
the 3,000 is all the regions added up, and they report every day what their hospitalization situation is, number of
Right.
COVID patients.
And yeah, there's about a 2-week lag. Okay, another question from John Finger. And if you don't mind, I'll take the first shot at this. It's where do you think the vaccination bottlenecks are? Is it still in the overall supply of vaccine available, or is it in delivery capabilities of various outlets? So there's various different issues, I think, going on in Texas. First of all, it was supposedly the states were allocated vaccine originally according to their population. And some reporters were calling me up early on, and I was calculating, and I always found that Texas was falling short, given its population, just a couple, 2 or 3 percentage points shorter in terms of how many vaccines it was supposed to be getting compared to what it was when you compared to Florida and California. And it turned out, they found out 2 or 3 weeks later that the population numbers they were using were actually from an average over 2014 to 2018. Whereas, and we all know that population has been steadily growing in Texas, so we got shortchanged in terms of the amount of vaccination we were receiving. But so the other issue, though, is where those vaccines are going. Texas, the state, decided early on that the bulk of that vaccine was going to go to the hospital systems. Now, that's terrific news if you are have health insurance and you are on electronic medical records for your healthcare provider. And so, I'm trying to think of the people that I know and I talk to on a regular basis. They have all gotten a shot. But as Judith mentioned, there's plenty of people who don't have the shots, and we know those are in low income, minority, people of color, those particular communities. And I've seen this in terms of I was able to get my cleaning staff access to a vaccine, and this is not vaccine hesitancy here. Many of these people want a vaccine, they just don't know how to get it. And so we also have a colleague of mine, Marcy O'Malley here. She talked with the cleaning staff in her building and said, did you get signed up to get a vaccine? They didn't know how. So she pulled her laptop up and got the cleaning staff all signed up so where they could get a shot. So there's things we have to do the hard work out here now to get these remaining people access to the vaccines. There is some vaccine hesitancy out there, but I don't think it's the major problem. The major problem is people do not know where and how to get a vaccine. If there are language problems, they don't have access to the internet, all sorts of information. Okay, so let me go. There's a question from Isaac Tapia. Does your slide 4 suggest there is no direct effect of wearing masks since the trend falls, but then also spikes? So why don't we go back to slide 4?
I am on slide 4, and what happened during the let's work with the blue curve, okay? Because this is the Gulf Coast, and we'll start back in the summer when the mask mandate, this is at the end of June, the beginning of July. So we were starting to see the effect of the Memorial Day holiday, of graduation parties, of people going to the beach. And the higher temperatures meant that you were spending more time inside in air conditioning. The Memorial Day holidays also into June showed the opening of a lot of your bars and restaurants, because at the end of May, the numbers were low and we thought that we were done. We had made it to the end of the pandemic. And no sooner did we move from phase 2 to phase 3, the numbers started going up again, and the governor issued the mask mandate, and this was able to turn the trend around, and the numbers went back down to the fall, and they were low until we started getting into the November holidays. And it's the November holidays where perhaps we were wearing masks when we traveled. Perhaps we were wearing masks when we went to visit our friends and families, but it was mixing it up on the road and in family gatherings that created another surge. And without the mask mandate, the numbers might have been higher. I can't say for certain, but it was in effect. Now we don't have the mask mandate. However, we have vaccination, and I know that depending on what time I go shopping, people, it's usually a mix now. Some people will be wearing their mask and some people won't. So it's constantly a changing picture. It's not like we're doing a controlled experiment. That's what makes this kind of work difficult. We can't say for certain. And, I'm going to leave it up to the public health PhDs and the epidemiologists to do those kinds of work. Our goal at the COVID Tracking Project was to make sure that the data was well displayed, that it represented the same thing from one state to the next, so that you could compare the numbers. And now the CDC has taken control of that of that mission, so that we can answer those kinds of questions.
Yeah, we have to wrap up, and I will just point out, as Judith said, this is one state, and there are actually studies done by epidemiologists, other researchers. You can Google those, and they can look at the mask mandates and all the other mandates at the same time, and have done studies that show that the mask mandates, along with other types of interventions, are effective in terms of controlling the spread of the virus. I'll just say there's one last question about asking if there's a volunteer organization in Houston to assist people finding a vaccine. I'm not sure. I'm not sure of that particular organization.
Yeah, I have been making calls and wanted to do some networking. If you're interested in maybe putting something like that together, maybe you could leave your name with the Baker Institute so that we could talk. I know that there are some United Way type organizations that I was going to approach, and Galveston County does have volunteer opportunities to work at the hub. But May is coming and we're running out of time. And I'm in my networking mode now, because at the beginning of May is when I want to move from the getting experience at a hub and moving to some kind of more outreach, one-on-one, helping people who don't have transportation, who, need the kind of support that Dr. Ho mentioned, when it comes to setting up an appointment and following up.
So there you go. Email me and I'll put you in touch with Dr. Oppenheim. Well, thank you so much for a fascinating presentation and for really going into the data in all parts of Texas and teaching us how different the experience has been all over the state and where we're doing well and where we need to improve. I wish you the best of luck in all of your work. And thanks everyone for joining us today. Have a good afternoon.